So for individuals who are in the early stages, you might want to increase the intensity of this workout by also adding a stability cushion that looks like this. Purchase one on Amazon. What this will do is this will increase the work in your abdominal wall. And so if you're in the early stages, you'll probably be fine to do this. And this is just a way to make sure you're also engaging the internal obliques, the TVA, the deepest layer of your core. But what I will say is when you put this stability disc on a chair, make sure your feet aren't dangling in the air. So for me, in this chair, I would need to put 2 yoga blocks under my feet. And I would have to do that for all exercises so that my feet are not hovering and I have that stability. Remember, your thighs, when you're seated, shouldn't be above the bony protrusions of your hips. They should be slightly below, and you want your ankles tracking under your knees and your feet solidly planted, perfectly parallel. Add this disc for any of the levels if you see fit. Okay, our first stretch, we're going to be opening up the hip flexors. We're going to sit sideways in a chair, and you want a chair that you can come into a supported lunge, so you're seated profile in the chair, and you're going to stretch one leg behind you, one leg in front. Breathing here, we're opening up the back leg's hip flexor. So think about your pelvis pulling down towards the floor, and take your outside arm up. And breathe. You can take a side body stretch over. Pull the lower abs in to support this movement. So if we're seated a lot for work or travel, these hip flexors get very tight. And depending on your posture, if you're sway back, flat back, or lordosis, they're going to be very active if you have lordosis. And they could be just posturally tight if you have sway back or flat back. Let's take 2 more breaths here, and then we'll switch sides, setting up on the second side to open up that other hip flexor. So as you're stretching here, let's get in touch with our breath, inhaling either through the nose or mouth, and exhaling out the mouth. Think about fogging a mirror with your breath. It sounds a little bit like Darth Vader, and in yoga we call it the Ujjayi breath. And you're constricting your vocal cords. This is actually a way to contract the deepest layer of your core, your transverse abdominis, which helps protect your low back. So you have to keep the belly pulled in. You don't want to push the belly out on your exhale. You want to pull it in towards the spine, and then fog a mirror with your exhale. And if you do have any issues with your bladder, this is a great way to condition the lower pelvic floor just by pulling it in and doing that Ujjayi breathing. We're going to make our way to a normal seat. You can turn and face me in your chair. You're going to grab your second to lightest loop band, and with the YouniquelyFit kit, this is our green loop band. We're going to bring it around our wrists, and we're going to take our arms overhead. Option to sit with your feet hip distance apart. If you have back or knee issues, you can bring them together to engage your inner thighs if you don't. So we're going to take our hands through that second to lightest band and lift our arms overhead. With our arms overhead, we're going to plug our shoulders down, lengthen the fingers up to the ceiling, lift your chin a little bit, take a nice long inhale. Imagine me pulling your pelvis down towards the floor, get longer through your torso, and exhale, pull out on the band with both hands, pulling out. 2, 3, 4. Inhale, plug the shoulders down, pausing the movement, and exhale, pull out on the band. 2, 3, both sides. And inhale, plug the shoulders. Exhale, pull out. 2, 3, 4. Keep that going. Inhale. And exhale, pull out. 2, 3, 4. 2 more sets. Inhale. Abs tight. Exhale and pull. 2, 3, 4. 1 more. Inhale. Brace your belly like you're going to be punched in the gut and fog a mirror. Take those arms back down. You can take that band off. We're going to do a little cross punching for your TVA. So bring your arms up like you're about to fight, fist. Take a nice inhale, pulling your pelvis down towards the floor. And on your exhale, I want you to twist and cross punch. Keep going until you finish your exhale. So cross punching the body. Good. Inhale, sit tall to prepare. Exhale, go hard, punching and twisting. And notice how that lower belly works underneath you. Inhale, feel your pelvis pull down towards the floor. Exhale, feel your inner thighs pull back towards the wall behind you so you sit up on the top of your sits bones, and then punch. Drive those punches. Find your target. Get any aggression you have out so that you can enjoy your day. I'm sure you can think of somebody that could use a big punch. Give it to them right now. Don't throw your shoulder out in the process, though. Keep those shoulders plugged down. Nice work. Couple more. Inhale, exhale, and punch. 2, 3, 4. One more set. Inhale, exhale, and punch. 2, 3, 4. Wonderful. From here, we're going to grab that second to lightest band we were just using, and we're going to place it back around our wrists. Take your arms back overhead, plug your shoulders down. Inhale to get longer through your spine, and exhale to side bend in one direction. Inhale to lift back up to center. So I want you to make sure that as you bend, you don't lift your hip, the opposite hip. So keep your pelvis grounded in the chair. You're getting a nice stretch under your armpits where your lats attach. Keep your head centered between your arms. Pull out on the band a little to engage your scapular stabilizers. Watch out for elevation in the shoulders, so really plug the shoulders down the back. Lift your chin up. We don't want that forward head syndrome. And imagine your shoulder blades are holding a pencil between them. I want you to pull them together, opening the front of the chest and engaging the serratus anterior, your shoulder blade anchor. 2 more. We're alternating sides, using our breath. Excellent. And 1 more. Okay, hold it up. Lower the arms down for a second. Just keep the hands on your thighs and roll your shoulders back. Give me 10 and 9. Breathing 8 and 7, 6 and 5. You're doing great. Chin up. Relax the facial muscles as you're working. No need to strain the chest or the facial muscles or the neck. Put the work in the tummy and the upper back. Go ahead and put your hands back through that loop band. We're going to add a breath. We'll be holding in our side bend, and this is going to engage the external obliques. So take the arms back up. Inhale. Exhale, bend to one side. Hold it here. Inhale 1, breathe. Exhale 1. And inhale back up. And going to the other side. Inhale 1, breathe. Exhale 1. Inhale back up. 2 breaths. Take it down, holding for 2 breaths. Inhale 1, breathe. Brace those abs. Exhale 1. Inhale 2. Exhale 2. Hold it. And inhale, lift. Taking it to the side. Inhale 1. Slow it down. Exhale 1. Inhale 2. Exhale 2. Inhale, lift. So try to hold 2 breaths at the bottom. Inhale 1. Breathe. Exhale 1. Inhale 2. And lift. And let's do 1 more for good measure. Pull the shoulder blades together. Lift your chin. Try to think about your front ribs melting through the body towards your back body so you don't get that arch and you don't disconnect from your core. Lower those arms down. Take that band off. We're going to do some alternating lateral flexion to really burn those internal and external obliques. Bring your arms down by your side, so if they'll be outside of the chair, outside of your hips. Sit up tall, inhale, and on your exhale, you're going to be bending side to side like this, working your obliques. So inhale, prepare, exhale, move side to side, reaching for the floor with each arm. Good. Great way to get those love handles in the back, out of the way, around that QL area. So sit up tall, make sure you're not slouching. Watch out for the head falling forward. So I always like to keep my eyes up a little higher than eye level, and that includes when you start to go down. Find a focal point on the wall when you're center, and then just follow the wall down as you lower, and keep going. Give me 2 more full sets. So we inhale, pause, we exhale, move. 2, 3, and keep the tempo quick here. We're looking for a little cardio. We're looking for a little burn in the low belly and the side body. 1 more set. Great. Okay, from here, let's take a gentle neck stretch. Interlace your hands behind your head. Tuck your chin to your chest and relax here. Elbows can come in towards the ears, applying a little more pressure. Sitting up tall, make sure that the weight of the hands doesn't cause your upper back to round forward. Keep your shoulders down your back, collarbone wide, proud chest, abs in. Couple more breaths here. Relaxing the facial muscles. Checking in with that ujjayi breath. Contracting the lower pelvic floor, lifting up on those muscles that stop your stream of pee on each exhale. So it's that internal lift. Feels like an elevator going up the shaft of your torso, energy out through the crown of the head. So you're pulling up, up, up on those muscles on your exhale. 1 more breath here. Feel free to turn the chin right or left if one side feels tighter than the other. Breathing. Great job. We're going to move into some upper body work. So I'd like you to grab your second to lightest loop band and you're going to step into it. And I'm going to have you step into it with the leg on the same side as your dominant arm. So place it around the thigh on the same side as your dominant arm. And then once you have it up on that thigh, you're going to take the hand through it so that you can lift your arm up like so. And this engages your serratus anterior. So stay seated, and you can do it without the resistance if it's too much on the joints. So you'll take the arm up, inhaling to lift it up so the elbow's in the same plane as the shoulder, creating a nice right angle. And then you'll lower it back down. So inhale, lift, and exhale, lower, and stay on that side. And if you're not using the resistance, you can hold it up and you can pulse it back to engage a little bit more of the tricep and the back of the shoulder. Keep the fingers long. Think about pulling in the core to support the movement as well. And we're going to be here for another 15 seconds. So you're either lowering and lifting. So kind of, they call this chicken wings on the Pilates apparatus. Kind of looks like a little chicken doing its thing here. Okay, let's switch sides. Plug your shoulders down. Watch out for droopy shoulders or elevating shoulders and droopy elbows. So my elbows are at the same height as my shoulders as they come up. So take it up and down, and don't close off that right angle. Make sure that that forearm helps you to create that right angle. So we're lifting and lowering, or we're pulsing back. And if you're doing the pulses, feel free to add a little torso twist to engage your abs as well, turning the body in the direction of the arm. So a lot of variations that will benefit your body here. Our goal is to recruit that shoulder blade anchor to combat kyphosis, to prevent injuries as you move through planes of motion. So you've got about 10 more seconds. Watch out for the belly pushing out on your exhales. Keep pulling it in towards the spine. Wonderful. 5 more seconds here. Hang in there. Make each one count. Great. From here, instead of this right angle, let's go back to our first side, and the arm is going to come straight through the band. So I like to slide it down near my knee, but still up on the thigh. And the arm goes out in line with the shoulder. Thumb is facing up. You're going to inhale, and you're going to exhale and pulse that arm up, using that resistance or not if it's too much. You got to be the judge of that. And lower down. Inhale, lift. Exhale, pulse up. 2, 3, 4, and lower. So that's our tempo if we're using the band. If we're keeping our arm, you can just hold it up and you can do some circles from the top of the shoulder. And that will really recruit the back of the shoulder, tone up the back of the arm, and keep that upper back engaged. Stay with that. Just a couple more seconds on the first side, and then I'm going to have you switch. So obviously, if you have the band on, you have to switch the thigh. It's around. So as you bend forward to do this, just be mindful if you have sway back or flat back, of keeping your abs braced. Because of the pelvic flexion in your skeletal structure, you run the risk of hurting your back when you do a lot of forward flexion. So you got to be careful. So let's switch sides, setting up on the other side for our scaption with subtle external rotation if it feels nice. Also, on this side, see how it feels to interlace the hands and to twist them across the body. So twisting, using those abdominals, lowering the arms, then lifting, then twisting. Sitting up tall in that chair, feeling the sits bones rooted like a tree. So your sacrum, your tailbone, is at the bottom of your spine. And I want you to think about that rooting down. That's going to give you a lot of length and a lot more engagement in your lower abdominals. If this twisting feels good, you can take it back to the first side and do a little loaded with the loop band. We've got another 45 seconds here, and I want you to do the variation that feels the most challenging. Perhaps it's scaption with our shoulder circles, or it's that torso twisting with the hands interlaced. I would recommend doing the most repetitions turning away from your dominant side, because your dominant side is going to constrict and be tighter. And as you turn away, you recruit the obliques on your non-dominant side, and they're going to be weaker. So that's a great thing to do for flexibility as well as strength. It's very imperative if you have scoliosis as well to not twist in the direction of your dominant side, to focus more on twisting away from the dominant side. Keep that going. 5 more seconds. You're doing great. Breathing. Let's take that loop band off. It's now going to go around our wrists. And some people like it a little closer to the elbows, like more on the forearms. Your elbows are going to be pinned in by the side of your body, palms facing up or towards one another. We're going to open that forearm out, engaging the external rotator cuff. Now, if this is too much, you can also take the band off and just do the movement, keeping the elbow glued to the side of your body. So we're working the back of the shoulder here, preventing rotator cuff tears by strengthening that area. Let's add a little lateral flexion to get the obliques involved as well. So what you're going to do is exhale as you bend, inhale as you bring that arm back in. Exhale as you bend, inhale, bring that arm back in. Keep that going. Exhale, bend, inhale, bring it in. Exhale, bend. And this is a great one to alternate side to side. Just make sure every time you inhale to lift, your pelvis pulls down and you sit up really tall and proud. Abs are engaged. Hang in there. Keep that going. Hear your breath. Inhale and exhale. So we exhale down, inhale, lift. Keep going. Exhale down, inhale, lift. Hang in there. Exhale down, inhale, lift. Exhale down, inhale, lift. Holding it down for 2 breaths. Take it down, hold it down. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale back up to center. Pelvis pulls down. Taking it to the other side. Exhale, bend. Hold it down. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. And inhale, lift back up to center. 1 more time on each side at this tempo. Side bending. Hold. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, lift. And last time, side bend. Hold it over. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. And slowly coming up. Take that band to the side. Take your hands and hold on to your shoulders. You're going to roll your elbows back, opening up those shoulders a little bit more. You can roll them back together or separately. Breathing into that nice shoulder opener. Your pec minor and anterior delts attach here. Make sure you go backwards and not forwards to help combat that kyphosis. Keep breathing. Keep your chin up. Focus a little higher than eye level. Use your breath here. Okay, from here, soft bend in the elbows, full arm circles, taking it around. And I want you to make a fist as you go up, working that grip strength, and release it as the arm comes down. So squeeze. So one thing we struggle with ALS is grip strength, and it can be really scary. So we want to keep working these muscles in a gentle fashion, plugging the shoulders down. We inhale to lift, squeezing that fist. Exhale to lower. Inhale to lift. Exhale to lower. And doing one arm at a time is fantastic. That unilateral work helps balance the body, helps you notice where you're tighter and where you're stronger. So, option to do single arms here. On our last 30 seconds, though, I'd like you to do both arms together at a very slow tempo, gripping the fist as you go up, inhale, releasing them as you go back, exhale. Keep that going. Inhale to lift, very slow tempo. You go at your tempo. No pulling any muscles today, just strengthening and stretching. Good. Give me one more here. Great job. We're going to move into some lower body work. What I would like, if you have sway back or flat back posture, I'd like you to grab that second to lightest loop band and bring it around your ankles. You're going to stay seated with it around your ankles. If you have lordosis or kyphotic lordotic, you do not need this band. We don't want to over-recruit those posturally overactive hip flexors. Everybody, bring your hands to your hips. Plug your shoulders down your back. Try to pull your shoulder blades together and lift the chin. We're going to do some marching here. Everybody but flat back posture is going to point your feet as you march. Point your toes. If you have flat back posture, you're going to flex your feet to combat that plantar flexion in your ankles. So sway back is pointing, lordosis and kyphotic lordotic, we're pointing our toes. Lift one thigh up, engaging the hip flexors and quadriceps, and then lower that leg down. Inhale to lift, exhale to lower. Stay on the same side as your dominant arm. So that's going to be your right if you're right or your left if you're left. Stay on that side first, pointing the toes as you lower and lift that leg. Follow me if you want to follow a tempo or follow your own tempo if it feels better on your body. So inhale to lift, exhale to lower. And you'll notice the front of the thigh around the groin, that's where you should be feeling a burn. Maybe the top of the thigh, but most likely those hip flexors are what's grabbing if you have that band on. If you don't have the band on, I'm hoping that you're grounding that pelvis down and you're using more abs than anything to lift up so that we can start to build up that abdomen that is not working as efficiently as it should. Keep breathing here. So let's switch to the other side now if you haven't. If you've been alternating, that's great for the abs, so keep going with that. If you haven't switched, go ahead and switch sides. Sitting up tall on the top of the sits bones, taking it up, holding it up, and lowering it down. It's important that you inhale to lift because I want you to think about using your low abs to control it as it goes down. And your exhale is when you're doing that Ujjayi breath where you've pulled your belly in towards your spine. So that's actually where you get the abdominal contraction and the control and you build the strength. Okay, from here, we're going to add a little twist. Bring your hands behind your head, interlacing them behind the head. Open the elbows out to the side. You can lean the head back like your hands are a hammock. Plug your shoulders down. We're going to add a lift of the same knee on the same side as your dominant arm first, and I want you to twist towards the knee you're lifting. So twist, but keep the torso lifted. So still keep your focus of your eyes up a little higher than eye level, and twist from your rib cage towards that knee, plugging the shoulders down. So we inhale, twist, exhale, lower. Inhale, twist, exhale, lower. You're doing great. Stay with it. Sitting up taller with each inhale. Bracing the abs, pulling back with the inner thighs, and I mean back towards the wall behind you to get you seated on the top of the sits bones. It's easy to slouch when you're in a chair. So we're going to combat that with a Deep lift of our pelvic floor. One more on this side. Okay, switch the twist and switch the leg. If you need to roll your shoulders out or do a few neck circles because you're fatiguing, take that time for yourself, and let's begin the other side when you're ready. Watch out for the upper body rounding forward. Don't let those arms pull your upper body forward. Think about your head resting back into the hands and the twisting happening from your rib cage. So the rib cage is twisting around. And that way we get a little more recruitment in the obliques. Pull your abs in as you come up and keep them lifted in and up as you lower down. Just 15 seconds left here. Make each one count. Going slow, bracing the abs. Hear that ocean breath like you're fogging a mirror on your exhales. And I like to tell women, nobody wants to get wrinkles around their lips, so don't pucker your lips. You don't have to. You can just keep your lips relaxed as you exhale and let it go there. All right, enough is enough. Let's make our way to a wall for an assisted quadricep stretch. Your quads are the front of your thighs. We're going to use our chair, and we'll hold on to a wall. We'll be able to take our foot onto that chair like so. And once it's on that chair, we can push the pelvis forward. So the top of the foot rests on the chair, and we can push the pelvis forward. This is a nice, gentle way. So the top of the foot's on a chair. You can have a hand on a wall for balance and push your pelvis forward. Going to hold it here, breathing into this nice quadricep stretch. After all those marches, our quads should be very worked and ready for a stretch. Make sure as you're doing this stretch, your shoulders are down your back, your collarbone is wide, your chin is lifted. Keep breathing. So from here, I'd like you to switch sides, setting up on the other side, taking your time, no rush. Now, if you're holding a wall, make sure you're not sticking your butt back towards the chair. I want you to pull your abs in and try to do a little tuck of the pelvis here, because that's going to intensify the stretch in the front of the quadricep. Watch out for your standing knee locking. Don't bow in or out in the knee. Keep the knee soft. Equal pressure through the inner and outer edge of the foot. If you're standing leg, you'll feel a little burn in the outer hip. Great way to build up your glute med, your outer hips, just doing this standing quad stretch. You just have another 15 seconds here. Hang on. Use that ujjayi breath. No pursing of the lips. Collarbone wide. Lift that chest up. Stay proud. Stay strong. Breathe here. Great. From here, there's two variations. If you have sway back or flat back posture, go ahead and take that second to lightest band around your ankles. And our KLP and LP, you're going to do the same thing. The exercise is different, but we all have our second to lightest band around our ankles. So with the band around our ankles, if you have sway back or flat back, you're going to lift your leg to knee flexion. And I want you to come over to a wall. So this is just like our marching seated. We're going to take our leg up to knee flexion. If you have kyphotic, lordotic, or lordosis, you're going to do a hamstring curl. So knee flexion for sway back and flat back, and hamstring curl for lordosis and KLP. So we're going to take that leg up and hold it. Start with the same leg as your non-dominant arm. So start on the non-dominant arm side of the body. And so you're standing, holding onto the wall like it's a bar, and you're going to lift the outside leg up to knee flexion with the loop band around the ankles. If you have KLP or LP, it's kicking behind you into hamstring curl. Everybody point your toes except flat back posture, you're dorsiflexing. So take it up and lower it down. Inhale, lift. Exhale, lower. And as far as your pelvis goes, if you have flat back or sway back, tip your tailbone back. Try to arch your low back here. Pull your abs in as you do that. I don't want your hips hiking. Your outer hand can be on your hip. If you have KLP or LP, tuck your pelvis under and show me that hamstring curl with pelvic flexion. Keep your low abs in. Focus on the quality of the movement here. We only have 15 seconds to go on this side. Keep your low abs in. Don't let them pooch out. Think about the rib cage, the front ribs, soften them in. Plug your shoulders down. Switch sides now. Setting up in the other side, remembering the pelvic position and how important it is for your back safety. So arch your back if you have sway back, excuse me, or flat back, and tuck the pelvis under if you have lordosis or kyphotic lordotic. Begin your hamstring curls or your knee flexion, depending on your posture. So outer hand on the hip, pull your shoulder blades together, lift your chin up, gaze is a little higher than eye level, and use your breath. Inhale to lift, exhale to lower. And if you're going at a tempo that's up and down, see if you can slow that down. Take maybe 4 counts to lift and 4 counts to lower. Think of your favorite ballad right now and sing it to yourself and go slower, slow down. Take your time. Give me 2 more. Great job. I'd like you to grab your small trigger ball. Now this can be a tennis ball, that would be a very gentle version, or a lacrosse ball, or they make specific balls for trigger work, which our goal is to massage fascia that's tight to release and dissipate muscles that have gotten into knots. So you're going to take that ball, put it under your foot. You can stand by a wall and you're going to roll out each foot one at a time. So stand by a wall and you'll notice as you're working into the foot areas that you're tight. Maybe it's your arch, maybe it's the ball of the foot, maybe it's the heel. Depending on your posture, most likely if you sway back, the outer edge of the foot is a little tenderer than the inner edge. And with our kyphotic, lordotic, and lordosis, because of the pronation, we're going to see the inner edge is tenderer. As you're doing this, you can be as aggressive as you can tolerate because you want to get into that foot so that you have better proprioception as we start to balance and move through space. So let's go ahead and switch sides, rolling out that other foot. And this feels so nice. And if you're fatigued from being up, feel free to sit down as you're doing this. You don't have to be standing, whatever you'd prefer. Our next exercise is standing, so you're going to have to make your way to a wall, but we have about 30 seconds. So be where you are, getting into those feet, warming them up before we begin our standing work. So we're going to do a nice pec minor and anterior delta opener as well as a little upper back strength next. So that ball can be set to the side and you're going to bring your back against a wall. So you may have to, in my case, I removed a couple pictures to do this, but hopefully you have a little wall space where your back can rest against the wall and you can bring your arms up to a high diamond. So a high diamond above you. Bring your arms up and see if you can get your arms into the wall. So the backs of the shoulders. You may have to walk your feet forward a bit, but see if you can get the upper back, the mid back to press into the wall. From here, slowly, one arm at a time, we're going to pull one arm down so that the elbow pulls all the way into the side body. So it bends, pulls in, and then goes back up. So it looks like this, slowly pulls into the side of the body, and then it comes down. So as you're doing that, watch out for the shoulders. Keep them plugged down. Exhale to pull down. So it mimics a lat pull down. If you were holding a bar and you were pulling it down, it would be the same motion. So you're getting the same muscles that recruit in a lat pull down here. But you're having to keep that imprint and not over-recruit those overactive pec muscles. This can get very tiring. Hang in there. You got a little longer to go. So staying on that same side, and then we'll switch in 10 seconds here. One arm is imprinting, the other is moving. Go ahead and switch sides. Inhale, prepare. Exhale, pull. And it's slow. Inhale as that arm comes up, pelvis pulls down in opposition. Exhale, inner thighs pull back to the wall to bring you onto your feet, helping you find those inner thighs and that lower pelvic floor. Another minute here. If you need to take a little forward fold of your upper back, you can keep your tailbone, your sacrum area connected to the wall, and you can fold your upper body forward just for a release. If not, you got another minute here. Keep going. Keep working that upper back strength. Nobody wants rounding in the front of the shoulders and to look like they're slouching or slumping. Roll those shoulders back. Fight to imprint the entire upper back into the wall, the backs of the arms. You're really pushing the shoulder blades into the wall, building that strength. 30 more seconds here. Low abs are lifting in and up. You hear that breath. Focus is up a little higher than eye level. Soft bend in the knees, not locking out. Each inhale as that arm raises up, imagine me pulling your pelvis to the floor. Your obliques get longer. Each exhale, you pull your inner thighs towards the wall, bringing you solidly onto those feet. 5 more seconds. Hang in there. 3, good, 2, and 1. All right. Take your second to lightest loop band around your wrists. And we're going to step in the frontal plane, which is side to side, boom, side to side. And as you're doing that, you're going to step to your knee flexion. Pull out on the band like so. You're going to step and find knee flexion. So step to the side, find knee flexion, hold knee flexion. You can always do this by a wall bar or counter for your safety. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Step to the other side. Find the balance. Hold. Inhale 1. Breathe. Reach the arms forward. Exhale 1. Inhale 2. Make sure your pelvis is back if you have sway back or flat back. Exhale 2. Toes are pointed. Inhale. Good. Second time on the first side. Travel through space. Find the balance immediately. Soft bend in the supporting knee. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Hold it. Inhale 3. Exhale 3. And last time, step to balance. Hold. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Great. So from here, we're going to come over to the wall for a stretch, okay? So you're going to bring your arm onto the wall for a pec stretch. You'll twist away from that arm, so place it against the wall, and then twist away to open up your pec major. Soft bend in your knees, lift of the chin, hold it here. Inhale, and exhale, twisting a little farther away from the arm. Good. Inhale, and exhale, twist. One more breath. Inhale. And exhale, twist. Switch sides, setting up on the second side. So start with the arm in a T and then twist away from that arm. Breathe here. Inhale. And exhale. Inhale. Exhale. One more breath here. Inhale. And exhale. Turn and face the wall, bringing both hands on the wall, chest height. Get very close to the wall. Almost your chest should almost be touching it. And now step one leg back so you're in a lunge. Push your pelvis forward, and you'll notice a stretch in your calves of your back leg. So if you need to widen the stance to feel the back leg's calf, you can widen that lunge. Push that pelvis forward. Keep your focus up. Keep your abs in. We'll be here for a minute. If at any point you need to come sit down and relax, get some water, do that. Be where you are right now. But the calves tend to be a major issue for flat back and sway back, and they can limit mobility. They can also be pulled pretty easily because of their overactivity. So it's great to stretch them out if you have these postures. And KLP and LP, you can benefit from it as well due to the type of training we have to do to combat ALS. So breathe here. Couple more breaths. All this balance work, you definitely want to stretch the calves after. Take a nice inhale, stepping forward. Exhale, step the other leg back. Driving the pelvis forward. So as you get more familiar with YouniquelyFit's programs, you'll recognize that when we're doing a postural stretch, and postural stretch means due to your skeletal structure, these muscles will constantly be tight until you learn to strengthen the other muscles that are not firing. So calves are a posturally tight muscle for sway back and flat back. So breathe here, inhaling and exhaling deeper into that posture. Inhale and exhale. And you can always take the hands to the hips. You don't have to have the hands against the wall. No need to strain the upper body if it is. Breathing, inhale and exhale. Last breath here, inhale and exhale, stepping forward. Great job. We're going to move into some squats. If you can grab your small anti-burst ball and your second to lightest loop band, you're going to bring your back against the wall, the ball between your inner thighs. So small anti-burst balls about this big. If you don't have one, you can just keep your legs hip distance apart, or you can get a pillow. You can squish it and squeeze it between your inner thighs. So let's take that loop band and stretch our arms out in line with our chest, and we're going to slide down the wall into a squat, keeping our back attached to the wall, walking the feet forward. Hold that squat, and if this is too much, just stay where you are. Take some deep breaths. Focus on some diaphragmatic breathing. Inhale, 2, 3, 4, 5. Breathing into the belly, and exhale, 2, 3, 4, 5. If you're in your squat, you're taking the arms up overhead, and as you stand back up, you're pulling them back down in line with your chest. So we exhale to sit back into that squat. Hold at the bottom. Inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And then we inhale, stand up, arms come back down. So our goal is to imprint the upper back against the wall when the arms come up. And we're at a right angle with our thighs and shins in that squat, squeezing with the inner thighs, that ball, building up the quadriceps and adductor strength. 2 breath hold at the bottom, and then we rise back up. Exhale to lower down, hold, inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale to lift. 2 more sets. Take it down, slowly lower down. Hold, inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale, lift up. And last set, taking it down. Hold it down. Inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale, lifting back up. We're going to move into some balance work through the transverse plane of motion. Now, the transverse plane of motion is where 90% of injuries occur. This is when we turn. So it's imperative that we train to combat this. So if you have kyphotic, lordotic, or lordosis, you'll be doing your hamstring curl with the second to lightest loop band. If you have sway back or flat back, I'd like you to find side knee flexion. So it's no longer in front, it's now out to the side, external rotation. So we're facing 12 o'clock with our body. We're going to take a quarter turn and lift the leg to side knee flexion, or a quarter turn and lift the leg to a hamstring curl if we're lordotic or kyphotic lordotic. So we have our side knee flexion for flat back and sway back, and we have our hamstring curl for KLP and LP. Make sure your band is around your ankles, and if you're doing the if you're doing the hamstring curl, you're bringing the foot inside the band, the arch of the foot inside the band. Otherwise, it's going to stay around the shin. Everybody is pointing their toes except flat back, you're dorsiflexing your feet. Okay, starting at 12 o'clock, you're turning either to 3 o'clock or 9 o'clock, hands on the hips. Give me that quarter turn, finding your balance in side knee flexion or your hamstring curl. Find that balance, hold. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2, try to hold it. No moving from one side to the other. Inhale 3. Exhale 3, step to balance on the other side. Find it. Inhale 1, pelvis pulls down. Exhale, inner thighs pull back. Inhale, pelvis pulls down, ground yourself. Exhale, inner thighs pull back. One more breath, keep your chin up. Inhale. And exhale, take it back to the first side, quarter turn, find the balance, hold. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And final time, stepping through that plane of motion, preventing your injuries by working unilateral balance in the transverse plane. Hold. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. And exhale 3. Great. From here, we're going to grab that second to lightest band and bring it around our upper arms above our elbows. And we're going to come into a sumo squat. So a sumo squat is a ballet second. So it's a low squat with external rotation of the legs. The arms are going to be up here. We're going to lower down. Inhale, exhale, pulse. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Inhale, lift. Take it down. Exhale, pulse. 2, 3, 4. And inhale. 2, 3, 4. And pulse. 2, 3, 4. Inhale, lift. So there's 2 full breaths at the bottom, and then we come up on the inhale. Take it down and lower down. Hold it down. Pulse. 2, 3, 4. Pulse. 2, 3, 4. And lift. Good. Exhale down. 2, 3, 4. Inhale. 2, 3, 4. Stay down. Exhale. 2, 3, 4. Inhale. Lift. And lower down. Exhale down. Hold it down. Pulse it. Use those low abs. Watch out for the knees bowing in or out. Let them track over your second and third metatarsals. Brace your abs to do this. Tip your tailbone back if you're sway back or flat back. Pull those low abs in. Keep going. Shoulder blades together. Just 20 more seconds. Use your breath. Hear that Darth Vader-like sound. Retract your shoulder blades. 15 seconds to go. Come on. Push yourself. This is for your cardio health. This is for your inner thigh strength, your balance, your glute strength. 5 seconds. Almost there. 4, 3, 2, 1. Great. Put that band to the side. Come to sit in a chair. We're going to work on your hands for a moment. So we're going to do a 5 count hold. So I want you to grip. We'll start with your dominant hand, okay? So gripping that dominant hand as hard as you can for 5 seconds, and then you're going to release for 5 seconds, okay? So we're gripping. 2, 3, 4, 5. Release. 2, 3, 4, 5. And grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. 2 more sets. Grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. Again, grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. And let's switch sides. If you need to roll those shoulders back, if that was intense at all for you, please do so. Go ahead, set up on the other side. Give me that fist. And here we go. Inhale, grip. 2, 3, 4, 5. Exhale, release. And grip. 2, 3, 4, 5. Release. 2 more sets. Grip, 2, 3, 4, 5, and release. And one more time. And grip, 2, 3, 4, 5, release. Other hand, roll that wrist out. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Roll it in for 10, 9, breathe 8, and 7, 6, 5, 4, 3, 2, 1. Flick the wrist as if you're saying bye, later. Keep that going. That's it. And switch hands. Start with that circle out. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Reverse it. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now we flick for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great job. We're entering our final series, our final 10 minutes together. So you're going to have your second to heaviest loop band around your outer thighs. And I'd like you to come over to a wall. Now, you're going to have your foam roller behind you for this, and you're going to use it for your lunges. Now, this is a rather challenging exercise. For some people, it's better to get a slider disc or a washcloth and put that under your back foot and just slide that back and forth because they tend to lose the foam roller. So the foam roller is behind your back foot and you're sliding back and forth in a lunge. And we're going back and forth, and we're obviously going to stay on one side because it's difficult to keep switching sides. So come to a wall bar or counter for safety's sake and hold on to it with one hand. Put the other hand on your hip. The band is around our outer thighs to help us find that hip distance and keep our abductors of the legs engaged. So I want the low abs pulled in, and I want you sliding back. It doesn't matter which side you begin with. Oftentimes I find that it's a little easier to start on with the leg forward on your dominant arm side because that leg is going to usually be more flexible, so you're going to go into that lunge a little easier. So keep that going. We're lunging. We're on one side. We either have a slider disc or the foam roller behind on top of our foot. Everybody's going to have to point their foot here just to keep that roller. I think flat back posture would benefit you more if you used the slider disc. That way you'll be able to dorsiflex your foot. That'll help combat that plantar flexion in your ankles. So flat back posture, I'm going to recommend losing the roller and staying with the slider disc or a wash rag. Continue where you are. And I'd like everybody to switch sides now, setting up on your second side. If you're feeling knee pain, just make sure you're using your low abs. I often notice when people are checking out with their midsection, all the weight of the body goes into the joints because you're sitting into it. So if you can actively use your breath and your lower pelvic floor, pulling the core in like you're going to be punched in your gut, sometimes you can make a staccato sound on your exhales for a while to find those abs, those lower abs, because they should be working to support you. Then you don't have to take the pressure in the joints. So keep going. We're on our second side. You're doing wonderful work. Slow tempo, slow down. Let's work slowly to build strength. We already raced through the day in a lot of other areas of our life. Let's take our time here. Exhale down. Inhale up. So that breath as you go back into the lunge slowly, you've got your ujjayi. As you come up, you have your inhale as your pelvis pulls down. Exhale back. Inhale up. And we exhale back. Inhale up. And this outside arm, if it feels better, you can take it up to shoulder flexion, palm facing in, shoulder down the back. Make sure that chin's not falling forward. Where's your gaze? Make sure your gaze is just a hair higher than eye level. Pull the low belly in towards the spine. Hear that breath. 10 seconds to go. Remember how important the abs and breath are to keep your back safe and to also keep your joints safe. Bring it in. From here, second to heaviest loop band around our upper arms above the elbows. So actually, and we're going to then put the forearms on our foam roller, bringing our body against the wall, legs together, and we're going to hold a plank. So we've got the second to heaviest loop band above our elbows. We pull out on it. Forearms go onto the wall on the roller, and you walk your legs back, feet hip distance apart, and we hold this modified forearm plank against the wall. So holding this plank, breathing here. I want to hear those inhales and those exhales. So the closer the legs are together, sometimes the harder it is, the farther apart they are, and the farther you walk back, obviously, the harder it is. So keep your chin up, keep your abs braced. If you feel any back discomfort, bring it in or open the legs wider. Soft bend in the knees. Now play around with kind of rolling the arms up just an inch and down, engaging your upper back to do that. Inhale the arms up an inch, exhale them down. Inhale them up, exhale them down. Inhale up, exhale down. One more. Inhale up and exhale down. Great. Our final balance exercise. We're not going to need any equipment for this, just a wall, bar, or counter close by for safety purposes. So this is a great way to open up the hamstrings to test your low ab strength and your balance. We're all going to take our arms out to a T. We're going to step forward through space. So we're stepping forward and back in the sagittal plane. And as we step forward, we're going to sweep our leg forward and back. So it's going to go forward and back, sweeps, little sweeps of the leg, trying to stay lifted through our core, holding our arms out to the side. So we'll inhale, exhale, sweep, 2, 3, 4, pause, inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4. Step forward on the leg that was sweeping, switch sides. Inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4, inhale, one more, exhale, sweep, 2, 3, 4. Now the challenging part. Now make sure when you're sweeping that leg, it can be parallel, but it can also be turned out. And if you've had a hip replacement, you just want to watch out for turning the leg in. You don't want the leg crossing the line of the body. You're going to make sure that you're turning out the leg in the hip socket or keeping it parallel. So now we're stepping backwards through space. So you step back onto one leg and sweep that leg back. Immediately begin those sweeps. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more, inhale. Exhale, sweep, 2, 3, 4. And last time, stepping back, flat back posture. You always have the option to flex your feet as you're working. Everybody else, point those toes. You want to send that energy through the legs. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more time, inhale. Exhale, sweep, 2, 3, 4. Great. Final stretches. Come over to the wall. Bring your arm into a single arm cactus. So face the wall so your chest is basically on the wall. Arm is in a single arm cactus. And now twist away from this arm, pushing the forearm into the wall and then leaning forward and away from the arm. You'll notice a nice stretch in the upper shoulder, pec minor, may be intense. If it's intense, breathe Don't push too hard into it. Just be where you are right now. Couple more breaths. Using those inhales and exhales. Let's switch sides slowly. Set up on the second side. Good. Bring one hand to your belly. Diaphragmatic breathing. Push your belly out here. Inhale, 2, 3, 4, 5. Let the belly fall back towards the spine. 2, 3, 4, 5. Inhale, push it out. 2, 3, 4, 5. Exhale, let it fall in. 2, 3, 4, 5. One more time. Push it out. 2, 3, 4, 5. Let it fall in. 2, 3, 4, 5. Great. From here, come to sit in your chair. We're going to close our eyes and do just a little relaxation to close our practice. So, option to bring your hands into this position where you interlace your fingers and you put your thumbs together, and you can rest the hands right on the thighs, plug the shoulders down. This opens up your throat chakra, allows you to speak your mind and be your authentic self. So let's close our eyes, and I want you to visualize a shade of blue that you associate with some sort of body of water where you've visited, vacation spot, a childhood memory, or perhaps a destination you long to go to. Put yourself in that blue water and keep your eyes closed here. Take a deep inhale and exhale. Smell that air around you. Again, inhale. Look at that blue. And inhale. And exhale, feel the water or the sand or the wind. And last breath, inhale. And exhale, let the eyes flutter open. You can always come back to this spot, come back to your breath whenever you're feeling overwhelmed. Great work.